now we are numbing her. Initially, I start with a smaller gauge needle, and I'm about to upsize to the big because we've been numbing her for a bit. This side is already done. This is called tumescent procedure with tumescent fluid that we have hanging. We have a combination of bicarb, epinephrine, and lidocaine in there. The bicarb helps with the burn. And this is a technique where we don't have to put patients asleep. They can be awake while we're numbing them. So I kind of initially start with a smaller needle initially, get her numb, and then I'm gonna upsize. And I use these same incisions for the actual liposuction. Some people use knives. I use a punch biopsy. It makes very small incisions and it's good to drain. So now I'm gonna numb her using the bigger one. She should be able to tolerate it a little bit better now because I've already put some numbing medication in her. So I start off as a lower pressure. I can adjust it with my handle, and I have a foot pedal, so this works for me. So I don't need a lot of help really during this part. And so this part, when I do this, goes a lot faster than the smaller needle because I can put more fluid in her and numb her more. All right, a little bit of pressure. Let me know if if it's too much, I'll go down on the pressure. Just numbing. This side's already done, and now I'm just gonna be numbing this side. A lot of scar tissue. That's why I'm going against scar tissue, if you feel me. This is my hand pushing up against you to help kind of distract you and let you know that I'm here, that's me. It's just some scar tissue that I'm running against. That we'll need to take down anyway for the liposuction, but I'm trying to numb this area. And then once this side is done, we'll let it sit for about 20-30 minutes to make sure she's completely numb. And then I'll use these same incisions on each side, and maybe make another one here, and I'll start the liposuction portion, which will go a little bit faster. But now this is just getting her nice and numb. This is the liposuction part. She's already pretty numb, tolerating this pretty well. And this is the suction from the liposuction that's dimpling. You can see that. And I use these small holes here that she won't even be able to see after liposuction. So I do a side at a time. I'm doing kind of the flank area, lower area. This is what she complained about, so I'm also going to get that area. And it's just a back and forth motion that will come through this tubing here, go into that cannula, and for her, we're going to re-implant this back in her face. I think fat transfer is better than filler. I think it lasts longer, and it's almost like a liquid facelift without all the cutting. So you can pull the fat from any area. We mix ours with PRP and stem cells for better regeneration. And fat transfer to the face can last years. So we'll do that once we finish kind of the abdomen part. But this is kind of the liposuction. I've already marked her before. And when patients lay down, it's hard to see the marking. And so we want to make sure we get a good result here. More body sculpting. Sucking as much fat as we can. And then we'll spin this down to do the face. And again, it comes through the tubing. We have a suction. We use suction-assisted liposuction. I think it works a little bit faster. Very small holes that I use. Again, I use a punch biopsy. The same one I used to inject her, I've used for this liposuction, so I don't make that many scars. She may have 4, and like you barely can probably see the ones that I've put in there. They'll close on their own. I leave them open after surgery because I let the fluid leak out of them over the next 24 hours, the tumescent fluid that I put in. And so I actually use those to help her drain. And they will close beautifully on their own. You won't even be able to tell that we've made scars in those areas for most people. minimal bruising with this because of the tumescent fluid that we use. And it's pretty well tolerated, done in the office. All right, so we're continuing the liposuction part. This side is, she's pretty numb. It's actually tolerated this pretty well. This side, we pretty much liposuction this. You will get some skin tightening, also with liposuction. But as you can see a pretty difference already. I'm starting on this side. A lot of this side is done. This is kind of some looser skin. But you can see this indentation here. And we have not done this side too. So this side is going to get done. It takes about 3 months before we see the full effects of liposuction. So you do get some disruption and suction of the fat, but you also get some skin tightening because of the disruption that we're going to do. And again, I use very small holes. These will disappear. This is where she's going to drain all the tumescent fluid that I put in. And it's kind of a typical, and you can see it's suctioning here, suction motion. And she's numb, she's awake. We've been talking about different things and tolerating it pretty well. And it suctions through here, and then it'll go into the suction. I use suction assisted. Again, it's a suction assisted liposuction. Different than laser, which has a light on the end and kind of helps guide you, but I do everything by feel. So I know where I'm at and how much skin to take because I can feel it. And so we're going to finish up this side and then use the fat that we've extracted and put it on the face. To the face, so to kind of start, I'm going to take out this area, do a little liposuction to this area here. So these are the little hole punch boxes. I've already numbed her. And so I put them here too because this is where I'm going to transfer the fat. You can use a knife. I just use the hole punches. And it leaves very small holes. And again, she'll drain. I've already numbed it. I used the tumescent fluid combination, but I didn't use as much of the fluid as I used for the abdomen. I just used essentially like a syringe for that. Punch biopsy, you just twist. And she didn't feel that at all. Oh, minimal? Okay. You're doing pretty good. Sorry, okay. And then now we're going to start the liposuction part. So I'm just going to go through this hole punch right here and suction the chin area. Lift up for me. Let's kind of weasel that in. This is how we do. We don't do a lot. It's not very, just a little bit to this area. And that's how we do submental liposuction. The fat, so after we do this, we're going to inject it in her face. Now we're going to start kind of the fat transfer. We have her fat and PRP in here. I've already made my little punch biopsy holes. You okay? Okay. All right, we're starting the fat transfer part. Okay. So I'm feeling for her bone right underneath. And the results of this can be pretty immediate. You'll feel pressure. That's all you should feel. You shouldn't feel pain. I'm going to have her bone. She feels pressure. Again, keep your eyes closed. There you go. Right underneath her eye. I'm just trying to fill this area. And again, it's almost like a facelift without cutting per se. Put it deep. And you can already see she's starting to get some cheek in this area versus over here. We have several of these that we're going to be putting in. Pressure.
It hurts. It's not pressure, it's pain.
Okay. Let me finish this syringe. All All right, now continue the fat transfer. This is PRP, stem cells mixed with her fat that we were re-injecting for a like liquid facelift almost. This is the same area I'd put filler, but I think fat lasts a little bit longer. All right, push in, and you can see the immediate lift here versus this side. And we'll do several of these syringes, and it actually lasts longer than a filler would. And you can see kind of the lift here that she's going to get, and we have not done that side yet. So it's an immediate difference, and I'll also do under the eye.